Back to the Nutrimedical report, and do we have Ron from Lumen Photon? I don't hear. Not yet. I guess we're working on it. Of course, what we are talking about is we have a range of technologies here, and I just want to kind of review some of the things that we're working on. We're working on the details of a franchise system where we will bring mobile, we call diagnostic and therapy vans, any country in the world. We're working on the details of how to do this legally in countries overseas, etc., here in America. What the fees will be to purchase the franchise, what the percentages of fees for specific treatments and diagnostics. And, of course, we want to make it very complete. There'll be several levels. The first level, basically, if you get a franchise, is you'll have a mild hyperbaric chamber or multiple chambers. You'll have QRMA diagnostics, ATLRS, and Metatron. You'll have to respond to all. You have to respond to all of our specific issues that we're going to raise in terms of the levels of authority we have over your operations, because you'll be acquiring data and information, and you'll only be exclusively able to sell our nutraceuticals by basically logging into our site, because we do shipping. You will not be warehousing in other countries. We'll ship directly into the specific customers or to you. And this will allow people to get therapy, diagnostics, even conventional blood, urine, stool tests done at labs, different places in the world, genetic analysis, and also we'll have levels of physicians involved to analyze the data so that they go to integrate it to regular medical care if they need to have more advanced testing, let's say for staging a cancer with a spiral CT PET scan, surgical referrals, and corroborative testing after the nonlinear testing is done, and morphogenic field therapy, nutraceutical therapy, detoxification, etc. So this will be very comprehensive. It'll also be very mobile. And the idea is if you're in a rural area of a country, this will be very advanced. With, of course, the diagnostics, we also want to have what we call surgical therapy vans, so that we can actually have mobile surgeons that can do dental care, surgical care, etc., that can be allied with our diagnostic and therapy vans, so that we can actually introduce, we call real care to different countries around the world, whether it's China, Russia, or other places. This is going to allow a kind of level of real, what we call healthcare, not just we call pre-embalming death care, which is what we've had for hundreds of years. We'll have real health care, which will actually restore the health of your tissues, your organs, your mineral concentration, your enzyme activity, detoxification, and the epigenetic control. So when we look at technology, we have Ron now from Lumen Photon. It's one of the therapies that will be in our Nutrimedical vans. And these mobile units will have all this technology, Lumen Photon, Micropulse, X-Vitalizer, and, of course, use the ATLRAS and Metatron to actually create morphogenic fields. In fact, we've talked about this before, Ron, that there is a possibility of using a feedback system using the ATLRS or Metatron to get a specific frequency feedback system for the therapy pads. In other words, you can actually diagnostically, in real time, pick up the frequencies to treat a particular area of the body, and as you're putting the infrared light over that particular target organ, let's say the liver, the nonlinear hydrophone will pick up the biophotonic signals and actually change the treatment frequency over the area. So I think we've talked about this before, that this is a possibility of actually changing treatment frequencies based on a feedback loop. Have you done any work on that area? Ron, are you there? I was told Ron is there, but I don't hear him, so he must be on mute. He must be on mute, or he's just been so overwhelmed he's now had a seizure and he's unconscious. Ron, are you there? Okay, I could try to see if we can get it back. Okay, we must have lost our connection. So here's how it'll work. Let's say you're in Belarus, or you're in Southern Johannesburg, South Africa, and you get your phone app or your iPad out. We'll know your GPS coordinates. We will then send a van out to an area that'll be moving around a city or town or a community that'll come out to actually diagnostic, find out what's wrong with you, can tell even before pathology develops in the organ system that has a possibility of a have a tech that can draw blood, urine, stool, then can actually then determine interface when they get the data. We can do sections of organs by logging on through TeamViewer 10 on the actual data from the ATLRIS or the Metatron, then determine if you need to actually see a specific medical doctor, surgeon, or have interventional care done. We will be able to tell you what nutraceuticals you can use instead of drugs. There are a very minimal amount of drugs that can be used in any circumstances. I say a general quote would be 20% of drugs are appropriate 20% of the time. In most cases, drugs are inappropriate and meddlesome. And in terms of prevention, drugs are never necessary. You need to actually fix the underlying physiological, genetic, and toxicological problem. And that's where lumen photon comes in. If you're going to regenerate, let's say, a joint, rather than getting a joint replacement. And I had this question raised yesterday by a gentleman who wanted a consultation. I said the first thing is, if you have fibrillated cartilage in a joint, you need to have an orthopedic surgeon wash that out, lavage it with arthroscopy, and deburr any rough areas of the joint surface with surgical arthroscopic devices that can actually smooth the joint out, wash out the garbage that's calcifying and acting like micro razor blades, and then you seal it up and get out of there and stop trying to repair, let's say, any partial tears or bucket handle tears of the menisci in the knee, or identify if there's partial tears of major ligaments. And what we do then, Ron, are you there?
Yes.
What happened? How did we lose our connection?
Lightning.
You're kidding.
No.
Yeah, you know what you do when you have lightning? You hold the phone 6 inches to a foot away from your head so you don't get a lightning spike inside of your head.
Yeah, and don't come in sweaty and walk over to one of my friends.
Believe it or not, people have done that. I've actually had people that I've seen in the emergency department that actually had the phone too close to their head, and the lightning spike jumped through the phone and hit them in the head.
Yeah, but this is one guy I actually knew, and he came in. It was really hot day in South Carolina. When it came in, and first thing he did was put his hand on the washing machine, which was on, and lightning struck, and he was dead. Bingo. So, yeah.
He didn't realize he was going to what's called washing machinocide.
There you go.
Yeah. Well, it's very good ground. If you're wet and you touch something like a big washing machine, it's well grounded. You're going to end up. Phones are like that too. So we're talking about our project for franchise for Nutrimedical, and I want to interface this even with we support, for example, Mercy Ships. It's one of the big ministries we support. And what the Mercy Ship does is it goes around the coast of all these different countries, and we have doctors and surgeons that go in and do eye surgery, or if a child has a cleft lip, or dental care. And I want to interface the diagnostics and we call the functional medical support of healing. So if you do need a diagnostic treatment or surgical treatment done or something else, you have the proper nutritional and epigenetic support to optimize healing. Maybe you need mild hyperbaric oxygen, you need lumen to speed up the healing and microcirculation, you need to control pain. For example, every post-op unit in the country, whether it's a mobile van or it's a hospital or an outpatient clinic, if they all use lumen photon, they probably give no narcotic medications to the patients, would they? Whether because you're doing abdominal or orthopedic surgery, you get pain, you slap the pads on as soon as somebody comes out, even through their dressings. They can have big fancy dressings on with Povidine or all the other garbage that the surgeons put on, and these stretch dressings are kind of clear. You can look through and see the wound to see if it looks okay. You can slap the pads right over top of it without disturbing the sterile field, and it'll speed healing. And that's why you can even slap on the lumen right through a cast. So someone had, let's say, a compounded fracture and they have it fixed in the operating room, they can heal it. So if you want to know more about lumen photon, contact us. It is an amazing device, and it will heal right through a foot of tissue, bone, ligament, and through casts, through surgical appliances. And it's one of my main things that I think people should have at home is a lumen. Basically, there's a thing called biophotonic entrainment, a pulse magnetic field like the micropulse, or lumen, which is pulse light. Light basically is the frequency of life. Every molecule vibrates in water is in infrared frequency, far and near infrared. And you can actually tell from the specific frequency spectral pattern the bonding backbone and the side groups on any molecule, biological molecule, looking at the specific frequencies. That's how we do IR spectroscopy and actually work out the chemical structure. When I did advanced organic chemistry, that's one of the things we had to do. We actually had to take the IR spectra and actually, in the exam, build the molecule based on the IR spectra. So you determine if there are imidazole groups, if there's pi bonding in the carbon backbone, what the side groups are, if there's a phenolic side group, and you can actually tell from the specific spectral pattern what those were if you're familiar with the spectral pattern frequencies. Well, the same thing works in the body. The cell membranes are a nonlinear stochastic supercomputer. Every cell in your body is a nonlinear stochastic parallel processing supercomputer. And genes are turned on and off by biophotonic frequencies. In fact, the information at the speed of light that regulates cells is much faster than the saltatory nerve conduction along myelinated nerve fibers, which is pretty fast. But the speed of light, which is biophotons, travels around the phenolic side groups of collagen, elastin, keratin, and hyaluronic acid. And those biophotons, when you entrain the right frequency, you can turn on ectoderm, mesoderm, and endoderm tissues, which are the primary different tissue types. And if you have specific frequencies, you can energize and heal nerves, bone, ligament, connective tissue, liver, whatever. And the combination of frequencies will entrain or pulse energy in there like a carrier frequency on a radio station to specifically activate the transcription of messenger RNA and the turning on of genes to allow the formation of cellular proteins, structural proteins, and enzymes to support life. So that little summary I gave explains what life is. Now, one of the problems, and this is the reason why when doctors are failed repeatedly, I call it the bug theory of intelligence. And I said this yesterday when I was talking to John B. Wells. I said, I don't have an intellectual attachment to my previous levels of stupidity. Unfortunately, a lot of people do. They actually are very emotionally attached to their previous levels of stupidity, so they won't let it go. And wisdom starts when you recognize how stupid you were and how much knowledge you lacked. So then you're willing to ask better questions so you can actually become wise. One of the problems that Dr. Nogier did solve was he basically was not only a health and wellness medical intuitive, because he actually knew intuitively what the frequencies were. He'd go back to the lab and actually test it. And when he developed the lumen pads and lumen treatment, which, by the way, are far superior to any other, infrared light machine, like Hammacher Schlemmer, that's in the airports, or a little comb to make your hair grow back from your scalp, or to make your skin lustrous and wonderful. So if you're trying to make your skin healthy, take Collagen Max, take Mountain Red Velvet, and take the Pro Collagen Stimulator, Her Royal Majesty's Royal Jelly, and then slap on your skin curcumin cream, which is anti-inflammatory healing and DNA repair, and put on lumen pads. So you want to stop wrinkling, you want to regrow hair, you want to get rid of blemishes, etc. Lumen is going to help. If you want to try to regrow joints, you want to detoxify your liver, slap the lumen pad over, dial in the right frequencies. What frequencies would you use for different conditions? And we'll start from the head to toe. Regrowing hair, activating the hair follicles, what frequency?
Well, primarily 4. We need more circulation, more oxygen coming into the site to help it. Yeah.
Okay, cataracts and intraocular hypertension, glaucoma.
7 and 3.
3 for the 7 to reduce the inflammation, 3 to stimulate healing, and that goes also for wet or dry macular changes or optic neuritis, right?
Yes. Yes. Yeah.
What about NICA or cavitations or periodontal disease, where there's basically cavitations around the teeth or tooth roots, or there's osteomyelitis of the bone, whether people have got materials intolerance, for example, to titanium posts, or they've got a perture, which is cadmium-laced heavy metals in their tooth root because they had a root canal done by an idiot dentist. It's non-biological. It would put down something that's a biotoxin in there, or mercury, which is even worse. What about if you're trying to heal those tissues?
Yeah, that would be 4 and 3 again. We're trying to regenerate the neural tissue in there, and then again the oxygen coming in, the circulation improve, that sort of thing. So
now, my recommendation is you're going to get rid of the biological toxins, whether it's cadmium or mercury. You want to see my dentist if you can travel within a couple hours here, and see Dr. Jeffrey Curbs. He's the best cosmetic and biological dentist. You want both. You don't want to find out you take out the mercury, but your teeth rock, or you get chronic TMJ problems, or it looks like hell. Yeah. And Dr. Jeffrey Curbs is the top dentist, I think, in this part of the world, actually. And he's in Escondido. So if you look at the links on my side there, see Dr. Jeffrey Curbs. And then if you've got Nika and you see Janae or one of his hygienists, they actually have what's called YAG lasers. They'll not only clean out the area with ozone, but they'll YAG laser out the dead tissue, and it'll start regenerating in from the base. So they have techniques and options with ozonation and the YAG laser that no one else and none of the other dental hygienists has in the state or anywhere else. There's only a very select number that are highly trained to know how to do this. And I tell people, if you're trying to heal your teeth, you want a lumen photon. If you're trying to heal your eyes or your brain, let's say you had a traumatic brain injury, have a micropulse, put it bitemporal, but slap on the lumen. The lumen pad, you can put it on the top of your head, and, you know, let's say instead of the tinfoil hat person, you should be a lumen hat person. You know, slide the lumen inside of your hat and run the little cords down the side to a battery pack. And people say, well, why? Well, you want to stop migraines, you want to regenerate your hair, you want to stop vertigo from your endolymph hypertension in your middle ear, balance mechanisms. Yeah. Then down the spine, chronic cervical pain. Most people don't realize you don't necessarily have to have anatomical encroachment of the nerves. You've got enough encroachment that you're irritating the dural nerve sleeve and producing tumor necrosis factor alpha, IFN, gamma, and other cytokines. And when you start slapping the lumen, it actually turns that off in your spinal epidural and we call epidural or perineural nerve sleeve. The posterior annulus, the ligamentum flavum, and the facet joints or apophyseal joints in your cervical, thoracic, or lumbar spine or rib heads. So if you want to turn off pain, you want to regenerate, you want lumen. What about coronary arteries? If you get a high-speed CT scan and shows calcification of your arteries, you want to reverse it, you want to take full vitamin K2, you want to take gamma E+, to reverse the calcification, and you want to slap on the lumen pad. What frequency to regenerate the heart would you recommend? Heart and lungs.
Well, heart is 5, 4, and then 3. 5, 4, 3, and 4 is probably that circulation and increasing that makes everything else happen, I think.
Yeah, 5, 4, and 3. Good. And what about if we're going down the abdomen? Let's say a woman has got chronic endometriosis, pelvic pain, premenstrual syndrome. Somebody's got colitis, irritable bowel syndrome, inflammatory bowel disease like Crohn's or ulcerative colitis, or chronic microcolitis, where basically the villi have been damaged from allergic reactions. And in Crohn's disease, they may even have fistulae between the bowel loops or their pelvis. What frequency would you use there?
I think there's some more pain than some of this, but 7 and number 4. And
7 and 4, yeah.
Yeah.
Thank you, Ron. Again, Lumen Photon. We have the links directly up on our website and on the front page under associates. These are amazing technology, affordable, and there's nothing new to buy. Once you get it, you just need electricity.
Yeah.
And they last if you take care of them for many years. Welcome back, and we have Dr. Fred Graves here from Jurisdictionary, and it's wonderful to have you on regularly, Dr. Fred. You do for the legal health of the population what I try to do for the medical, epigenetic, and spiritual health. And, of course, you do the legal and spiritual side because there's always a spiritual side to the law and the proper rules of evidence and the rules of procedure, which, as you've said repeatedly, is the core to mastering the idea of how to be a pro se litigant and a proper legal consumer. I've had a case earlier this hour talking to Deborah about a case that she was dealing with, and I said, you need to take Dr. Fred Gray's course. Don't be frustrated. Don't hire an attorney under the Bar Association who will either drag it out, cost you too much, and may not even adhere to these proper rules that he's teaching, so the case will either fail or cost you a fortune. And when you master them, you can become a proper legal consumer, so even if you hire an attorney, you can have a whip to crack to make certain they do follow these procedures to make sure your case doesn't fail. You can gather the proper evidence without interrogatories, and in fact, you've taught me that most cases are won long before they get to court if they follow your procedures.
That is right. You know, I had the thought today to share with your listeners to ask themselves, what is your number one right? What is your number one right? What is the most important right that any of us have in a free society, so-called? What is the number one right? And when you ask people that, they'll say, well, I have the right to contract, I have the right to free speech, I have the right to peaceably assemble, and so forth and so on. But then I tell them, I say, no, there's a more important right than that. and they look bewildered. And then I have to tell them, because they don't figure it out, because my profession has seen to it that people don't know what their number one right is. And the number one right, the most important right we have, is the right to know how the system works. How do we get justice? How is it got? How did the corporations get the United States Supreme Court to rule that corporations are people? You know, how did Monsanto get all the advantages it has out there with these genetically adjusted seeds and so forth? How did they get their rights advanced, or rights so-called, which, of course, I disagree with those rights. I think they're wrong. But how did they get those rights? What is the process? And it seems to me, and I don't think that anybody in their right mind can argue with me, that the most important right is the right to know how rights are enforced in this country. And because if you don't know, then what good are all the other rights? What we sit around and talk about it, we cry in our beer about it, get all sad about it, all burned out about it, and join clubs, go meet together on Tuesday night, and and wear flak jackets and sign up for dry food stuffs and things like that. But it's not changing anything. The thing that will change this country is when the people realize that they have a right to know how to enforce their rights. They have a right to know how rights are enforced by these wealthy people. And they have a right to know, and they should know, that anybody with even a minuscule grasp of the English language and a small amount of common sense can understand this process. And I like to emphasize with people, whether you want to go to court on your own or not, or whether you want to hire a lawyer, to not understand how justice is secured in this country, and it's certainly being secured by the rich people, isn't it?
Rich, or the various parties that are factions that are systematically destroying the country by the perversions of the law and its applications.
Absolutely. And when the people themselves begin to see, it's like we began to be more health conscious. I think, when was it, Dr. Bill? Back in the 70s? That it became almost faddish to jog, and then we got into clean water, and then we started talking about, the wheat, what the stuff is in wheat. I'll have to avoid that. Oh my goodness. But we didn't even think about those things much back in the 60s.
Right.
And it became popular to be health conscious. So why should it not be popular today? We'd like it to be popular. We've given people an opportunity to make it popular and make it easy. Why not make people conscious of their rights and how to enforce them? Let this be the age of learning about law. Just like we had an age of learning about health. And may it continue, because we certainly need to know all we can know about health. But I remember back in the 50s and 60s, it wasn't much talked about, and people died of polio.
Right.
I had friends that died of polio, that died of lockjaw, tetanus. We became more health conscious. Now we need to become more conscious of the process of enforcing justice and commanding the courts to do what we, the people, want, instead of sitting around while the courts do what the rich and famous want.
Or factions. We have a lot of factions now where, they call them political action committees, PACs. And we're now being steered by groups that are actually systematically destroying the moral basis for a civil society, the logical basis for the small business to grow to become medium and large, the squelching innovation and education. And so everything is acting as a corrosive to society, all has its roots in legal. And so what you're doing is trying to restore the fact that if we don't have control of the voter box, that's one thing, and we realize there's voter fraud. But if we control the evidence box, if you want to call it, then we won't go to the cartridge box, which is a violent revolution. And in fact, this is what I'm very fearful of. We want people to be prepared to have their Second Amendment rights, but it's like anything. You don't have a gun to shoot people. You have a gun so you don't have to shoot people. You have legal rights applied so that you can go to church safely and you don't need to worry about a martial law, and you can actually have your rights to express yourself correctly honored by society because you have sovereignty, because you honor the fact that, you know, God made us in His image, and those spiritual principles are reflected in the law. Right now, they're stripping them out. The personhood issue, and we talked about this before about the unborn, the right of inheritorship, even these principles were put into the law, and if we properly prosecuted them, all this millions of dollars going to various groups doing pro-life would be solved very quickly if they just applied your principles to take a legal action. They wouldn't keep on wringing their hands over decades and say, we got to get the right politician and we got to do this and that. No, you simply have to file the right legal actions of rules of evidence and procedure. And even Supreme Court justices said this the same way, whether it's water rights or corporations doing crazy stuff or carbon capture and craziness of people like Obama and what I call the false media, people that are involved with trying to push carbon capture and the carbon credit system. All of this needs to be attacked with your system. It's not something you can attack by, we can talk about it in the media, but you can't vote it away by voting for the right person. It has to come down to the courts, doesn't it?
That's right, and you can't talk loud enough or carry enough signs in the street. It ultimately will be decided when a judge puts his signature on a piece of paper called an order or a judgment. Yeah. That is when it's decided.
Yeah. In other words, what we're saying is that everything that you do is you're a legal surgeon with a scalpel of rules of evidence and procedure, and you're a surgeon, okay, with a law, and everything else is what I call catharsis, which means all you are is have a scalpel to drain the pus from the abscess, but you have to surgically remove the abscess. And that only happens in the courts.
We can all know how to do that. That's the thing that just blows my mind. It's not difficult to know how to do. Whether we're hiring a lawyer or doing it ourselves, we can learn how the system works, and we need to. Yes, sir.
Yes, indeed. Stay right there. We'll be back on for the next segment as well. We're going to have lots of time today to continue this discussion. Dr. Fred Graves. Dr. Fred, we had a little fun during the break to talk about the importance of law, and we used a couple of terms. I like to call it self-flagellating, in other words, taking a whip and beating yourself and almost glorying in the suffering you have. I like to talk about it with the people with the signs. It's like they have a tumor, a legal tumor, hanging off them that's dragging on the ground. And while they're dragging their leg, because the tumor is attached to their leg, the sign is, I'm protesting this growing tumor. And you come along and say, if you went to court and saw a legal surgeon, which is yourself, trained to properly the rules of evidence, you could have that lopped off by presenting your evidence before a judge and getting proper interrogatories, and that tumor would be removed surgically, and the wound would heal within days. But they say, no, I must continue my 30-pound tumor because I'm protesting its growth. And before they get around the corner, it's grown another pound. And they're angry at you because they think you're evil, suggesting that they could actually surgically remove the tumor because they are glorying in their own self-flagellation, a form of narcissistic egotism that they have been protesting for years, and the tumor is still growing.
Well, now I have to say this, if you will permit me. Okay. I also have a book on Amazon called The Gospel Mystery.
Yes, I got that the other day, by the way.
Good. Wonderful. And what we have these 501c3 corporations that call themselves churches that refuse to get involved in the political arena because they will lose their 501c3 exemption. And because of that, and the fact that the mystery of the gospel is not being taught, we're waiting on Jesus to do everything. So he will come back soon and fix everything. And that is not what the gospel is.
No.
Paul says that the gospel is Christ in us, the hope of glory.
Right.
Christ in us. Wanting to do these things, wanting to make a difference, getting out and making a difference, who's sitting around waiting on somebody else to make the difference for us.
Right.
That's who Christ is.
I got a new title for you.
He's a mover.
I consider you a mortarman for the New Jerusalem. In other words, we're the living stones, and you're making up the legal mortar to make a civil world. And the problem is that because the chaos masters are creating more social chaos between different skin types or groups or stratification of different levels of income or different countries, the chaos masters like the United Nations and the World Watch Institute and the Council on Foreign Relations and Obama and the leftist communists, these people are all masters of chaos, including the neo-Nazis, I called, in the Republican Party, that want to basically create more chaos and war. And really the solution is proper legal application of the principles you teach would allow a satisfaction to bring all the parties to a final point of conclusion, so you wouldn't have a reason for war or conflict or something that would be unreasonable. And in other words, it's the lack of the proper application of the law that creates the circumstances for revolution and war.
And if I may, I think, too, part of the root is that we don't understand the gospel. You see, remember we're in John 7:17, where Jesus is praying. He says to the Father, and he said, "Thou and me, and I and them, that they may be one." When we begin to realize it's all his work, it's his doing within us, and we stop resisting that, and we stop getting in the way with our own ideas about what's appropriate, and listen to the still small voice within us that's telling us what to do, then we'll get off our keisters and get out and get involved in politics and get involved in the courts and get involved in fixing what's broken instead of sitting around crying about it.
One of the big problems with our country is our legal system and our political system have married. So I think 80% of our politicians are lawyers. And it's a very similar thing to the medical system. Virtually 95% of the doctors in this country are not capable of defending a master's or PhD thesis because they lack the inductive or deductive logic or the ethics to actually be able to present evidence to prove that what they're doing is based on facts and truth. And the problem is, you see, the legal system lends to professions, which is why the highest paid prostitutes in the country are not in Las Vegas. They're in the Beltway around Washington, D.C.
So true.
Yeah.
Sad, but true. But,
yeah.
We have the tools. Remember, you said that I was the mortar. Well, that's not true. I appreciate the comment.
No, you're a mortarman. You're mixing up the mortar. You're mixing up the mortar by giving people the legal mortar to put the people to... Yeah.
Yeah, it's there. It existed before I was born. It's just that my thing is that I just made up my mind. I was sick and tired of the secret. I think the people need to know. I think they have a right to know. And I've been doing all I can for 18 years to show them, this is your power. You have this power. Now get out and do something about it instead of sitting around moaning and dragging your abscess along the floor with your sign being proud. Look at my abscess. Look at what a wonderful human being. I'm protesting my abscess. What nonsense. How can this so-called patriot community be that ignorant?
Well, I talked to the Paralife Group.
Remain ignorant, which there's a consequence to our ignorance.
Right. I see this, for example, with the recent thing of the bailing in policies of the federal government, the Canadian Bank of the Bank of International Settlements, and what happened in Cyprus a couple of years ago. These policies, if we dealt with them legally, they would be considered irrational, and you'd stop it before they create a crisis and literally bail in everybody's pension funds. The same way as primary water. We know primary water exists, and instead they're going to actually dehydrate California and Texas and the southwestern states to the point where you have massive population shifts and devastation in the economy. The problem is there's a consequence to not dealing with this. Same way with pro-life. We have 55 million dead babies in America and around the world funded by Americans because we won't deal with these clear facts that a baby is distinct from the mother, it's not her body, and that the baby at the moment of conception is genetically complete. There's nothing new to make them up except the cells multiply and then form into organ plates and tubes and so on and organize.
And the written opinion in Roe versus Wade states, right in the opinion, they can Google it and read it for themselves. All you listeners out there, I dare you, go Google it and look at the written opinion and read it. About 2/3 of the way through, it says there could have been a different outcome to this case, but the parties did not argue it. Well, shame on us.
Right. So most of these things actually, and this is nice. It's nice to have a politician, let's say, a pro-life doctor like Dr. Rand Paul, but Dr. Rand can't do it unless because even when they make a law, we have the right to review that law and either apply it or make sure it's properly interpreted by the courts with rules of evidence, or strike it down to say this is unconstitutional or illogical, or as it like in Roe versus Wade, prove that the law is not based on it's in conflict with other laws already proven in the case law, like the right of inheritorship, etc. Right. And for example, in Canada and in other Western countries, if someone does vehicular homicide and kills a mother and the baby in utero, and the baby would have inherited, say, millions of dollars from the father, but they die, the person that struck and did vehicular homicide because they're under the influence of drugs or alcohol is guilty of 2 murders, not 1. Well, how can you murder a baby if it's only a sack of cells, when in fact it's actually a person?
It is. It's
a legal person, it's an inheritable person, it's a person that has rights. And the same thing with seniors, with Obamacare.
We need to learn how to enforce those rights. We must learn how to enforce those rights, whether we go to court on our own, whether we get the course so that we can do this on our own for our own selfish purposes, or whether we get this course so that we can share it with other people in our church, in our community, and be able to start enlightening the world as we did enlightening the world about health back in the 70s. We've got to enlighten the world about justice, and it needs to be done today.
Well, I would say half of the church, if you want to call it, teaching session every Sunday or Saturday if they have a Saturday evening, half of it should include the issues of their community that require legal action and what Christians should be legal salt and light to protect the society from evil.
Absolutely. Get rid
half of the time.
Free and organized as commercial trust.
Yeah, amazing. Get the course, Jurisdictionary. The link is up on our associates page right in the front of Nutrimedical. This is essential. If you're whining, don't whine. Don't whine. Do something about it. Don't haul your tumor and scrape and self-flagellate that you're such a great person because you've got this giant tumor. Get it lopped off legally, becoming a pro se litigant expert. Thank you, Dr. Fred. You're doing an amazing job, and God bless you.
God bless you, sir. Bye-bye.